So how is metacognitive therapy different from cognitive behavioral therapy, from CBT? In CBT, a lot of focus is on dealing with the thoughts themselves. So the content of what someone thinks is important according to CBT. So if someone thinks, I'm not good enough, that content is important to deal with in order to make that person feel better and overcome depression, for example. Metacognitive therapy doesn't deal with the content of your problems or thoughts. It really doesn't matter the kind of thoughts you think and the kind of feelings that you're having. What we're interested in looking at is how much time do you spend dwelling on these thoughts, and whether that dwelling and the amount of time you spend on those thoughts is helpful. And if it's not, we will work on reducing the time you do that and instead learn to use your attention on other things rather than just worrying and ruminating. So you can say that cognitive behavioral therapy focuses on the content of thoughts and emotions. Metacognitive therapy raises a level above that and deals with how do you actually deal with these thoughts and emotions. Both therapies are built on different theories of what constitutes mental illness. Therefore, metacognitive therapy is not a third wave or an extension of cognitive behavioral therapy. Metacognitive therapy is a completely different way of doing therapy. So who benefits from metacognitive therapy? As long as there is some sort of CAS activity going on, then you can benefit from metacognitive therapy. So CAS activity means using unhelpful strategies to deal with thoughts and emotions. And primarily, most people engage in either worrying or rumination or thought suppression. And as long as someone does that, and the consequences are anxiety, depression, OCD, low self-esteem, then we can deal with that in metacognitive therapy because we know how to reduce the CAS.